Aubrey Plaza in beautiful downtown Wilmington, Delaware. We are the Podcast Pediatricians. I'm Rob Walter, and again, flying solo today as Matt is out there probably struggling to finish our book club book by next week. I mean, it's a really short book, Everything is Tuberculosis. I don't think he should cheat again and use a cliff note, so here's hoping. So just got back from Disney. Hot Topics and Pediatrics, so much fun. Over 500 attendees this year. It just gets bigger and bigger. And once again, hit my favorite ride, Guardians of the Galaxy, with Disco Inferno. Susan does not like the ride. She does not do them. But then I found my new favorite roller coaster, and that's the Stardust Racer in Universal Epic. So thank you, Sam. This year, for only the second time, I actually gave my own talk at Hot Topics. I did one 5 years ago on the top 7 things to ask at a teen visit, and I guess I'll do it every 5 years if they'll take me. But this year, I did my own talk on the top 10 tips for expectant and new moms. And I don't go to the hospital anymore for newborns the last couple of years, and I really miss it. Those out of you who still do it, kudos. There's lots of factors that kind of pushed us away from doing it, but I do really miss it. And after I gave the talk, my buddy there said it didn't suck, which for us is really high praise. So I thought I'd share it before I forget it, probably by next week. But first, our disclaimer. I am sharing personal opinions on pediatric care. Always talk to your own pediatric caregiver about your child. Pediatric caregivers should always consult expert guidelines and consider their own community standards of care. So, my top 10 tips for expectant and new parents, where I shamelessly stole ideas from speakers of 11 years at Hot Topic Pediatrics at Disney, 28 years chairing the R.Y. Warren Pediatrics Seminar, my colleagues, pediatricians, nurse practitioners, PAs, with 38 years as a board certified pediatrician, 28 in independent community care, mostly suburban practice, and from all my families, and our lactation consultant. So sadly, as I said at the talk, I have no conflicts, but I do have opinions. First, I do want to give a shameless plug to the R.Y. Warren Seminar Wednesday, November 11th at Nemours Children's. We kick off with our keynote national expert on ARFID, psychologist Dr. Dalsgaard, and then have multiple talks, including psychopharmacology, obesity, GI, allergy. It's mostly Nemours alumni. We have masters in pediatric speakers, Dan Doyle and Steve Selps, and then a really nice alumni receptions afterward with libations. So if you're near Wilmington, Delaware, we would love to see you. Okay, on to my top 10 tips. Number 1, which I try to say in prenatals. Well, I don't see newborns in the hospital anymore. I still do prenatal meet and greets where the parents come in with a list and you talk to them and try to tell them about being a new parent. A lot of these tips I'll use at my meet and greets. It's always a little bit of competitive juices. They're coming in like, I really want you to come to see me. That would be a great thing for you. I'd be great for your family. You don't want to go across town to see Matt Gotthold because, oh my goodness. But then sometimes halfway through, I think us pediatric caregivers have been there. Halfway through, you're trying to woo them, and then rarely sometimes you're like, oh, maybe they should pick somebody else. And maybe you're kind of not wanting to woo them. So that's always a weird position to be in. If I see them first in the hospital when I used to do that, to the mom mostly, breastfeeding does not define your role as a mother. Yes, the AP guidelines are exclusive breastfeeding recommended for 6 months and continue for 2 years. But breastfeeding struggles should not ruin the new mom experience. And over the years, some moms, even if it was going well, they just didn't like to do it, even if the latch was fine. So we all know there's so many health benefits to breast milk. But formula is pretty healthy too. Supplementing a little bit with formula will not ruin breastfeeding. And oh my goodness, when it's pushed so the mom feels badly about it, it really can worsen her postpartum depression and anxiety. With nursing police, I guess it's gotten better in the last few years compared to 25, 30 years ago, but still, I think all moms need to hear that. Any breast milk is great. Some is better than none. Colostrum is great. Even if it's not exclusive breastfeeding, even if it's just for a few weeks or a few months, Pumped breast milk may have a little less microbiome benefits, but it's the same milk. It's also great. I think I've said this before. I have said to my mom that if she would have breastfed, maybe I would have been a neurosurgeon. Now, back in the early 60s on Long Island, I guess it wasn't considered the gauche thing to do to breastfeed. She does not like for me to say that. She gets very upset, so I try not to, but it's my mom. But I do find that it's really helpful to establish that in the beginning. We're going to do everything we can, but it's not going to make or break your motherhood. And the vast majority of babies in my practice breastfeed more than 6 months, most over 12 months, and early lactation consultant is the key. Hopefully your hospitals have one there. It used to be that only first-time moms were getting it and not second time, which I think is ridiculous. They all should be offered it, period. My practice is lucky enough to have a lactation consultant in the office, and we've had that for decades. I think we were the first in Delaware, and if it's possible for people out there, it would be great to have one in your office. So other things I talk about feeding and such. One is some young infants have a lot of non-nutritive sucking needs, and judicious use of the pacifier will not ruin breastfeeding. We try to wait a few weeks, but some babies just want to suck all the time, and mom will get really sore. Also, the most common cause of infrequent stooling in the first few weeks is the baby is not getting enough milk. Number 2 and number 3 are the baby is not getting enough milk. There are rare things like Hirschsprung's disease, where they have an obstruction, and they really don't pass meconium the first few days, but most of the time, it's a good marker if they're not getting enough milk is that they're not stooling as much. Another point, all parents need to know at the beginning that all newborns lose weight in the first days, just expect it. It could take a few weeks to get back to birth weight, just like all newborns hiccup, sneeze, and get jaundice. And one tip for pediatric caregivers out there, because jaundice is normal, and it could take weeks to completely go away, especially if breastfed. But if a baby really has yellow eyes at 2 weeks of age, then just make sure that you have a direct bilirubin to rule out biliary atresia, because if you pick that up early, it can make a big difference in prognosis. Okay, next I say to most parents that tongue ties are usually normal variants, but allow me to rant, as Matt and I have ranted many times before. The frenotomy epidemic. 866% in frenotomies from 1997 to 2012. There are no good studies on lasers, on uniform definitions of posterior tongue tie or lip tie, and surely not on buccal tie, whatever that is. The AAP in July of 2024 said frenotomy is only indicated if it affects breastfeeding after a lactation consult. In January of 2026, in Pediatrics by Raoul, a study showed ankylosing alone does not affect breastfeeding maintenance or weight gain. And there's no evidence that frenotomy improves speech, language, or behind every anterior tongue tie there's a posterior tongue tie, or that lip ties cause breastfeeding, speech, and eating issues, or that there's a need to phalange your lip in order to breastfeed. You really don't. Yet, I think experienced pediatric caregivers know that often a frenotomy can help babies after a lactation consultant feels that would be helpful. So it's not as if it's always black and white that they're good or they're bad. Sometimes it really makes a big difference, and that's why I really lean on a lactation consultant. And then the issue of should it be an ENT clipping, should it be a laser by the dentist? At this point, I don't really care that much. I just want to make sure they're experienced, that they take the parents' insurance, hopefully. And I also try to mention, if I have the opportunity early, that beware a relationship of the people doing the tongue tie repair with chiropractors, craniosacral therapists, and PT body workers. I mean, I've just seen that a lot. There's not any evidence based on these types of maneuvers and case reports of injuries, especially maneuvering the neck as a chiropractor in the newborn period. So I really try to steer people away from that. But I'll keep an open mind if studies come out differently. My number 2 tip for new parents, sleep is really important. Yes, for the baby, but also for you guys. The AAP guideline talks about back to sleep to reduce SIDS risk, but once the newborn can roll to their belly on their own, you don't need to roll them back. So I try to warn parents about that, because sometimes I find even after a few months of age, they're waking up in the middle of the night and rolling their baby back in their belly. If they can get to their belly on their own, they're okay. Start them on the back, but if they can get to their belly, okay. And try to put their head sometimes to the right and sometimes to the left, so they have less chance of getting a flat head. Obviously, by the AAP, using an approved crib and bassinet with a firm mattress, fitted sheet, no pillows, blankets, bumper pads, stuffies until at least 12 months, and never bed share or couch or armchair sleep, or sleep extended periods in a car seat or swing. The only patient I've had who had a SIDS type of diagnosis actually was on a couch. So I think that was the issue. And then, the AAP in October of 2016 said that newborns should room share at least the first months, but ideally up to 12 months. And many of us pediatricians said, really? And that was the origin story with the podcast Pediatricians with Matt and I. So we did our own research, but we did get the 4 papers in the guidelines that they cited that were from the 1990s in Europe before the back to sleep. And it showed that the risk really was only increased if the parents were smokers, and none of our parents were smokers. And our opinion is babies do not need to sleep in the parents' room 6 to 12 months. They can if they want, but you also have to take into account the parental sleep deprivation from rooming in that can increase depression, increase parental car crashes. So suffice to say, Matt and I really don't push rooming in. My 10 sleep commandments, only if parents want their baby to sleep through the night as soon as possible and prevent some sleep issues, is number 1. I think the first time we did this, I sang like it was Hamilton. I'm not doing that today. So number 1, for newborns, initially feed every 2 to 3 hours a day and wake up by 4 hours overnight. But once the baby gets to birth weight, you never need to wake them up overnight to feed ever. Let natural sunlight come in the morning when they're sleeping during the day, and make it darker at night so they get a circadian rhythm. Number 4, and you really can't spoil newborns. You can let them fall asleep in your arms early, but over time, you want to try to put that down sleepy but awake so they learn some self-soothing techniques. And there's really no fixed rule on how long to let your baby cry. There's crying and there's screaming. As the weeks and months pass, keep moving the baby further and further from the parent's bed. The baby can smell you, and you can hear every burp, grunt, and fart they make. Every inch farther from the bed will help, but I usually say only if mom is okay with it. Don't care as much about dad, depending on what their situation is. But, if mom feels like they can't be away from me, then absolutely that's fine. The 6th of my 10 commandments, parents should try to tag team at night. Again, parents' sleep is important, especially if they're formula or if they're pumping breast milk. It's nice they want to do it together, but if they always get up together, they're both going to be really sleep deprived. And mom's going to anyway be the most sleep deprived, but it's great if they can tag team it, and sometimes mom can put earplugs in and maybe a sleep mask and go to the other room. If she's breastfeeding, sometimes it's uncomfortable to go too long without pumping or breastfeeding, but at least try to maximize her sleep. Number 7, babies should wear maybe one thin layer more than the parents. Everybody gets a lot of layouts, but you don't want to overbundle a baby because they're poikilotherms and they can get too warm. And you can swaddle a baby until they're really trying to turn over at about 2 to 4 months, but never swaddle too tight on the legs because that increased hip dysplasia risk. Number 8, the snooze, the baby snooze. They cost a lot of money, and some parents love them, and they may increase sleep, but I do have some concerns about if the baby will learn to fall asleep without rocking and white noise down the line. Number 9, something again more recent, the sock outlets, sleep sock pulse oximeters. In the AAP in June of 22 said these do not lessen SIDS risks, and honestly, they can drive parents crazy. I remember as attending when pulse ox came out and you were in the call room and the pulse ox kept going off 2 doors down, it drove me crazy. So I don't think it's really worth it. And number 10, some babies are just not great sleepers. So I've had families with 5 kids. They do the same thing, and that one kid is not a good sleeper. He ends up growing up and being fine, but it's not always what they do. Sometimes there's intrinsic issues with the baby. And lastly, it's a nice shower gift to give a night nurse for a few days or a week, and along with a snot sucker. Okay, in my top 10 tips, number 3 is all babies spit up. Set expectations early that all babies spit up. I talk about it the first time I see them. This peaks around 1 month, but even at 4 months, 60% of babies still do, and a quarter of them more than 4 times a day. Babies have very small stomachs. Day 1, it's the size of a cherry, like a teaspoon. Day 2, it's less than an ounce. Day 7, it's less usually than 2 ounces, like a big apricot. By week 3, it's 2 to 3 ounces like a large egg. So that's why you need to feed babies small amounts 8 to 12 times a day and warn them that they will spit up so they're not always thinking, oh, this is reflux. And also then beware of overfeeding. Watch gravity, positioning, keeping them upright after feeds, head of the bed up, have a good burping routine. Okay, then I digressed a little bit about young infant GERD, and I want to give thanks to Dr. Carlo DiLorenzo, stand-up comedian and master GI doctor out of Nationwide, who's instilled this in me over his talks at Disney. We have put too many young infants on H2 blockers and PPIs. And a couple decades ago, a lot of Zantac. And I was guilty of it also. The good news, out of Journal of Pediatrics and Hirsch last year, PPI use is down over 50% in these young infants from 2014 to 2025. So that's good. And if you have a concern that's not just spitting up and there may be reflux coming 2 to 3 or more months of age, again, start with positioning, smaller feeds. If it's still fussy and spitting up and they're formula fed, you can consider going to a partially or fully hydrolyzed formula. I wouldn't jump right to an amino acid formula, and especially if there's any trace blood in the stool. If they're exclusively breastfeeding, I've always told parents just to cut out the dairy and soy, the moms, from their diet. Although a recent talk by Dr. Stukas this week at Hot Topics, maybe that isn't going to help very much. But if there's still issues with spitting up and seeming uncomfortable, then comes the thickening. And some people would do thickening first, but I then would do thickening if they are a big baby. You may want to use gel mix because it's less calories. Otherwise, you can use cereal. It's about half a tablespoon to 1 tablespoon per ounce of the milk, and you make sure that you cut the nipple. And then only consider meds or a GI consult if the above fails, especially if there's anemia, failure to thrive, refusal to eat. Crying can be normal up to 2 hours a day. That doesn't mean they have reflux. And Carlo will sometimes say that arching with GERD is a bit of a myth. I'm not sure I'd go that far, but we really have a lot of things to do before we start talking about medications, especially if they're growing okay. Okay, the 4th tip I have, which is something that's new in the past 5 years, is brain bleeds are bad. Say it again, baby brain bleeds are bad. All newborns need vitamin K, single IM shot 1 milligram at less than 6 hours of age. We've been doing this since 1961, since I've been born. OBs will not do a circ without it. And vitamin K deficiency bleeding is a real thing. There is no vitamin K that gets to the placenta. There's minimal in breast milk. Formula is not enough. It's really deficient until they get solid foods. And there's different types of vitamin K bleeding. The first is the early onset in the first day. Often, if mom is on certain anti-seizure medications or infectious disease medications, which makes the liver break down the vitamin K, they can get bruising up to life-threatening intracranial hemorrhages. The classic bleeding from vitamin K deficiency from 2 days to a week is moderate to severe, like post-circumcision bleeding, and is more common in breastfed infants. But then there's the late onset vitamin K bleeding. It's almost always in exclusively breastfed babies, and this presents with an intracranial bleed in 30 to 60% of the time, and 20% die. And many others have brain injury, cerebral palsy, that's lifelong. And this is virtually eliminated if they get vitamin K at birth. And particularly, you can see it from 1 to 8, 10 weeks, but even up to 6 months. And we've been doing this vitamin K for over 60 years. So please, 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 parents, don't skip the vitamin K. If they do skip it, the baby's 81 times more likely to get that late onset bleeding, which is often a brain bleed. 1 in 60 newborns without getting this vitamin K will bleed. And the scary part, which is why now I have to bring this up, which I didn't even see this 5 years ago, is that the trends are that more and more new parents are refusing the vitamin K. A paper in January of 2026 out of CHOP by Scott et al. And JAMA, newborn vitamin K refusals increased 77% since 2017, from 2.9% to over 5%, looking at 403 hospitals in 50 states. And the refusal rates rose every single year. And often parents said that it wasn't natural to get vitamin K. It seems vitamin K is less likely to be given in birth centers and with midwives. The only time I had this was a doula who said to the parents that they shouldn't get it at the birth center. And when they came in to see me the next day, I did put a little bit of fear of God into them, and they ended up going back to the birth center and getting the vitamin K because I didn't have it in my office. So there's a lot of misinformation out there, but this one, brain bleeds are bad. The link to leukemia is disproven. The benzoyl alcohol in it is minimal. As always, the dose makes the poison. So there is not anything in terms of chemicals in this vitamin K that's going to give you leukemia. And then there's oral vitamin K. So some studies show that it didn't work as well as getting the shot. And so it's not approved in the United States. But it is used in Europe. And there was an editorial in JAMA Peds a few months ago in April pleading that the FDA approve oral vitamin K just so something's better than nothing. So if they won't get the injection, but they'll get the oral one, that would be at least something. Although the worry would be that more and more people would then just choose the oral one instead of getting the injection, and that may not be good. And there was a nice talk before Hot Topics, the day before, in a cardiology neonatology meeting at Disney, where Dr. Ken Alexander gave his tips on dealing with this and just said when you're offering most vaccines, or certainly these newborn vitamin K and hepatitis B, just simply say it's routine, it's safe, it prevents brain bleeds and cerebral palsy, and stop talking. Maybe more often the parents will say okay. Okay, my number 5 tip for new parents is that newborns have a high infection risk and vaccinations save lives. All newborns have a higher risk of infection. Their immune systems are immature. Group B strep prophylaxis that started during my career, where they culture mom, and if she's positive, they give mom antibiotics for the baby's born, has been amazing. I haven't seen a significant group B strep infection of a baby since then, and I used to see it, which includes meningitis. We should discuss RSV, and that's a new thing to discuss with parents, the maternal vaccination of mom in the 3rd trimester, or passive RSV immunoglobulin to the baby at birth or after up until 8 months of age. And either one's recommended by the AAP, and both have shown to be great at reducing RSV infection in young babies, which can be devastating. I did cover a paper comparing the two, and it does seem that the immunoglobulin has overall better protection than a maternal vaccine, and maybe someday we'll do both, although in low-income countries they may only be able to do the maternal vaccine because of cost. But they should get RSV protection, and now thankfully our local hospital is doing it for the newborns, but when they're born after the season but they need it for the next season, your friendly neighborhood pediatric caregivers will be there with this monoclonal RSV antibody for RSV. Okay, I also talk about the flu vaccine and to give it to all the contacts, especially the new moms, because I, for years, told new moms that their immune system now is the same immune system of a 65-year-old woman, that having a baby sucks out their immune system. Now that I'm 65 myself, hits me a little bit different way, but these breastfeeding moms have triple reasons. One, because they're high risk and we don't want them to get it. Two, we don't want them to give it to the baby. And three, if they're breastfeeding, then they can give antibodies to the baby because the baby can't get the first flu shot until 6 months of age. Also, stressing all the time, wash hands, wash hands, wash hands. They need to do that with these young infants around. And as mentioned, these babies are kind of poikilotherms, so don't overwrap them. And then I particularly specifically talk about what a fever is. And the gold standard is a rectal temperature of 38 degrees Celsius or 100.4 degrees Fahrenheit. If they want to screen by doing axillary or forehead, if it's 99 or above, then they should check a rectal. So they should have a rectal thermometer in the house. I really, really do not like ear thermometers. Over the years, whenever I get someone calling that their child has 108 temperature and they're watching Barney, my first question is it an ear thermometer? Like, yes, it is. So I try to stay away from them. And then also make the point that low temperatures are concerning also. Hepatitis B universal newborn vaccine. I mentioned it. It's such a success, a 99% reduction in pediatric hepatitis B infections since 1991. That first birth dose is 75 to 95% effective preventing hepatitis B if the mom's affected, if the mom is infected. It fills the gap if mom is not tested or if her test is wrong or she hasn't seroconverted. There were 16,000 cases of hepatitis B under age 10 in 1991, and a couple years ago there were 22. This vaccine works. And chronic Hep B has a 15 to 25% lifetime death, cirrhosis, liver cancer risk. Vaccinations are shared decisions, so we sometimes talk about that. What are you thinking about that? There's a lot of scary info out there, especially now. And then I outline our practice's minimum vaccination policy. And for us, it's they need to get measles and they need to get pertussis. And we had done a hot controversy at Disney years ago about whether you should kick out non-vaxxers. And it's a moral issue, right? Someone needs to take care of these babies, and it's not the baby's fault if the parents don't want them vaccinated. So we really felt we wanted to protect our waiting room, especially after an outbreak about 12 years ago at Disneyland. And now, this week, there's an outbreak of measles in Delaware. So this week, we are now offering the measles vaccines from 6 to 11 months, getting it early. They still need 2 more after that to fully get immunized. And also offering a last dose early. Instead of 4, they can get it no less than a month after the typical 12-month MMR dose. And what about us pediatric caregivers? Well, if you were born before 1957, you're fine. But if you got the first version of the vaccine, I think it was 1963 to 1967, and you were born after 1957, then you probably might want to get another MMR. And I didn't remember, but luckily, since I'm a kind of a hoarder, I saved all these papers from way back, and I had the piece of paper that when I was a resident at Children's Memorial Chicago in the mid-'80s, I got 2 MMRs. So thank you, Northwestern Children's Memorial. Okay, one other specific thing is, what about the deferral of ocular erythromycin ointment prophylaxis to prevent gonococcal ophthalmia neonatorum, which can lead to blindness in 3% and corneal disease, and most U.S. states require it, but the Canadian Pediatric Society advocates against it. They don't feel it helps if it's chlamydia. There's more resistance of GC to erythromycin. The condition is treatable, and countries who have eliminated this ocular erythromycin ointment have had no increases in infection or blindness. And some would say that universal screening for GC and chlamydia in the first trimester is a better strategy than giving the ointment to every single baby. The AP seems to agree, but it's been reaffirmed to be the law by the USPSTF in 2019. So my bottom line, if a parent refuses to get the erythromycin ointment prophylaxis, I make sure the GC screen is negative. I tell parents to immediately seek medical attention if they have eye discharge and inflammation. and then I just let it go. Number 6, postpartum anxiety is common. Oh my goodness. The incidence is up to 25%. It's much higher than the more discussed and screened for postpartum depression. And of course, anxiety in everyone is soaring. When I see the hospital discharge of a newborn baby and they talk about the mother's health, it seems like 75% of the time it lists anxiety as one of the mother's diagnoses. And the media is full of stories about risks to newborns and children wherever they turn. So we should be very proactive to ask about anxiety, ask about support systems and therapy. And some who are being treated with medication, the most common one usually is sertraline, because that's considered the safest with breastfeeding. Okay, number 7 tip is about newborn screen. First, blood screens. So we screen newborns now for 35 to 60 disorders to prevent morbidity and mortality. 2 to 8% of the babies will get an out-of-range result, and most are okay. So there's about 50 false alarms for every true case in the newborn blood screen, especially thyroid and congenital adrenal hyperplasia, because that's where timing matters. If they get it before 24 hours, if they get it at 20 hours or 18, they're more likely to get a false positive. And these parents already are anxious. So it's nice before the baby's born, if possible, just to let them know that if this happens, we'll deal with it, but it doesn't mean that it is going to be a disease. The other newborn screen that's newer is the hearing screen. So this started in the early 90s. It's in all 50 states. They do this OAE test of the cochlear hair cells initially for most babies, unless they're in the NICU, and then they get an auditory brainstem response, more specialized screen. And 80 to 90% of newborns who fail this initial screen twice in the hospital have normal hearing when they follow up with the ABR, auditory brainstem response. And these two tests do not test functional hearing. They test a physiologic response to sound. If they truly have decreased hearing on the ABR, only a little more than a third are sensory neural, usually it's genetic or CMV, and the rest may be temporary, effusion, debris in the canal. So I do tell new parents, if they fail the hearing test, don't tell grandma right away. So we will get a CMV test in the hospital, usually a urine, before discharge. If they fail the hearing, you have to get it within 21 days to know if it really is true CMV. I find this fascinating that in Minnesota and Connecticut, they now have added a CME screen for all newborns on their bloodstream. And then they confirm the disease with a urine PCR. So they are diagnosing much more CMV than we would just by looking at hearing. And they're preventing CMV hearing loss, since about a quarter of asymptomatic congenital CMV babies who have a normal hearing screen at birth will have hearing loss by age 18. And getting treated with antivirals, though again, cyclovir is one, may prevent this. So I really hope that Delaware and PA and all the states end up adopting this. And oh my goodness, just cool wow factor. In Nature in 2026, they reported a cure of otoferlin genetic deafness. There's many different types of genetic deafness by getting nasal viral gene therapy. So, wow, groundbreaking. And now this is FDA approved, and this is probably only just the beginning. Okay, number 8 tip for new parents. Reading. Read to your children every day. And multilingualism is a superpower. So reading, and you're talking to your baby a lot from the beginning. A language-rich environment is so great for their brain. It's never early to keep talking about that to new families. And parents are the role models, so they should get off their screens and their cell phones as the baby grows up. And if a parent speaks another language, just start from the get-go speaking both languages. Being bilingual is a gift. After age 10, the brain is less receptive to languages. You will not confuse your baby with 2 languages. When I started almost 30 years ago, a lot of my first generation families who had English as a second language basically did not speak their native language at home. They didn't want to confuse the babies, and that is not the way to go. And I find that my families now know this, and they're speaking all kinds of languages from the get-go. And another quick thing about hearing and language, If you have a child who's congenitally deaf, maybe going to get a cochlear implant, make sure they're taught ACL, American Sign Language, from the get-go so they can be bilingual with American Sign Language. They'll have a better outcome. There is some debate in the deaf community if you want them to speak, that you shouldn't do sign language, but not doing sign language really is a much higher risk of having language delay. So get the ASL in from the beginning. Okay, number 9 tip. Maybe I should move this up to number 1 and 2. But the tip is don't diss grandma or grandpa to a lesser extent. If grandpa is bringing the child in, pretty much, not always, but pretty much they have no other choice. But this includes us pediatric caregivers too with grandmas. Grandmas do babysitting, meals, sage advice, and yes, more and more of them are the primary caretaker. Now, the corollary to don't diss grandma is sometimes grandparents need to hear from us that they are not the decision makers, but be very, very careful about that. And number 10, the last tip, maybe the most important one, trust your instincts. You can do this. I don't care if both parents are very young. They should trust their instincts because they're usually going to be spot on, period. And I do encourage mom especially to go out every day without the baby. Take a walk for a couple minutes if you want to. Many go to Target. That seems to be a thing. All right, some last things. I put them out, corollaries after number 10. Make sure parents check their health insurance before delivery. Yes, kids get mental health issues and speech issues. Circumcision, I used to get a lot of questions about that. I really don't. Really, at this point, do whatever you want. Make sure pain control is used. And yes, they talk about UTI risk more and penile cancer if you're not circumcised. But with good hygiene, usually it's not a big deal. Although who knows what your kid's hygiene is going to be like 20 years from now. Next is moisturize early and often. Some studies show that regular moisturizing from 1 to 2 months of age can really reduce the risk of later eczema by about 25%. Next is make sure you buy a gift from the newborn to any of the big siblings. It's a little bit of bribery, but the older siblings are usually the biggest threat to the baby. Sometimes they don't mean it. Sometimes they're feeding him a grape or they're carrying him down the stairs. And a gift from the get-go is a really nice start. It can't be socks. It's got to be something cool. Next, 10G, warn about parental technoference. Again, be present with the baby. Get off your phone and beware of nomophobia, fear of being without a smartphone. I have that. When I can't find my smartphone, I'm like, not good. But the last thing that only pertains to people in the Philadelphia area when you're talking to new parents. The last thing you should say to them, of course, is go birds. And you can't see this when I gave the talk. I then showed a slide of my new grandson after I went home from his birth. My daughter sent me a text with a picture of him head to toe in Washington Commanders gear. I mean, the horror of it all. So I just baited my time for weeks and weeks and weeks. When I came back to see them, I offered to babysit a night for them to go out to dinner, and then I brought all my Phillies gear, and we had a secret Eagles baptism with many, many pictures of him in full Eagles regalia. Okay, that's it, folks. And you didn't think I'd finish without mentioning that LeBron James is taking his talents to Philadelphia. I'm not sure there's enough basketballs for all these guys, but it should be fun. And since it's the Sixers, it will probably blow up. But very excited right now about the Sixers and less so about the Phillies. So good night, Matt, and good night, Moon. Podcast Pediatricians Productions. All rights reserved.